loud and clear.
All right.
I don't.
Yeah. Uh, so basically, when we look at monitoring and evaluation, we really focus on especially we really focus on how to keep track of a program or a project in order to know whether it is doing what it is supposed to do and at what cost is it doing that. And then whenever there is a problem with that program or project, we can always adjust so that we have the best results. So monitoring per se does take place throughout the span of that project or program. So from the word go, you have to monitor and see what is going wrong and be able to rectify it. Evaluation, on the other hand, can take place at the end of the project or after some stipulated time to see whether you are achieving or whether you achieved what you had planned to achieve as far as a project or a program is concerned. So as far as nutrition is concerned, if you have a nutrition program of maybe reducing malnutrition in the southern region of South Sudan, that would be a very big thing. So from the word go, you want to evaluate, you want to monitor whether that program is meeting its set objectives, as we are going to see. So I wanted us to differentiate between monitoring and evaluation to know that yes, they go hand in hand, but they are a bit different from each other. Session and module, a project is different from a program. Like I said, if you focusing on if you have if as nutritionists or as students of Bristol, we have put up a program to reduce malnutrition in the southern side of South Sudan, we need some specific projects, maybe a project to reduce malnutrition or stunting in under fives. So you can see the project will be short, it will be of a short term of a short term basis, and it will be narrowly focused. It is focusing on those under fives. So that is why we are saying to be short term and to be narrowly focused in terms of scope and duration. That is how it is differentiated from the program. And then in terms of goals, we realize that goals of a program tend to be multifaceted. They tend to be broader. They tend to look at those and have a lot of population groups. But when we focus it on now the under fives, then it now becomes something smaller and it can be entailed in a project. So the target population is also something that differentiates a program from a project. So far we have seen that a program can be differentiated from a project in three ways. We can see the scope, the goals, and then the target population. So going on, we also realize that the funding and resources also differentiate programs from projects, whereby obviously for you to face a bigger target population, for you to set bigger goals, for you to have that bigger scope, you need more funding and resources, and this can be a bit bigger than what you need in a nutritional project. So this is all showing that a program is a bigger thing, and it can in it we can have smaller projects. Okay, so we can have one program which is having a lot of projects. So one project under malnutrition in the south of South Sudan, we can have many programs. We have many projects. We have already talked about that in the malnutrition or stunting in under fives. We can also look at uh, we can also look at underweight amongst adolescents. We can also look at the malnutrition in pregnant women. So we can have a lot of projects here and there. So you will realize that, as I said, the projects will need fewer or smaller funding or resources as compared to a program, because the program is the bigger thing as far as nutrition programs and projects is concerned. So again, when we look at monitoring and evaluation, the one that is needed in the program context needs to be robust. It needs to be able to look at those long-term goals, whereas in that nutrition project, because we are saying that the scope and the duration will be a bit smaller, so now the M&E doesn't need to be as robust as that in a program. That doesn't mean that in a project you do not need M&E. You also need M&E in a project as well as a program. But of course, in a program, you will need more M&E. You will need more resources to do this M&E in terms of financial resources and also the human resources. So a program will employ more M&E officers, for example, than the project does. Okay. So we also realize that uh, generally a program, as we can see from these differences, is generally the bigger thing, and then the project is a smaller one. So the other differences can also include the fact that uh, the resources that are needed by the program are always they're always tapped on by this project. So you might be having an ongoing program of say reducing malnutrition in the south of South Sudan. So if you have M&E people who are already in that program, who are already employed, they can be tapped by now a project which is focusing on stunting among under 5 children in that area. So you do not have to 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 hire other people, but you can still use those people if you do not have enough resources. So that could be another difference, that a project might not have standalone, uh, they might not have standalone resources that can tap on the program, but in most cases, programs have their standalone resources. Yeah, so going on, we need to also look at how we set goals and objectives in this nutritional program. So the goal should be SMART, and by this time, I expect us to know what SMART means. We are not talking about the fact that the goal should put on a suit or a very nice skirt, but we are looking at the fact that it should be specific in nature, it should be measurable, it should be attainable or achievable, it should be realistic in nature, and there should be a time bound aspect in that goal. So when you look at this goal that we are having here, an example that is focusing on reducing malnutrition rates, we are saying that the goal is to reduce the prevalence of malnutrition in the target population. So this goal, while it is good, but it is not so specific, I brought this up here to open our eyes to realize that yes, it is a good goal, but it needs to be more specific. Which target population are we looking at? For example, are we looking at the pregnant women? Are we looking at the under 5 children? Are we looking at the adolescents? Are we looking at the elderly? So all these age groups, remember, can face this malnutrition. So you have to make it so specific. You have to make it very time bound. So for example, here, if we had to qualify this goal, it would be uh, to decrease the prevalence of malnutrition in among or among the under fives by, and also that aspect of the population and the geographical location should also come so as to be more specific. So it could be to decrease the prevalence of malnutrition in or among the under fives uh, in South Sudan or the southern part of South Sudan by 2030. So that would be time bound. The time bound aspect comes in, the specificity comes in, and even we can see that it can be measurable because of that aspect of prevalence. So the goal is the broader thing. Now, when we look at objectives, now we are being more specific. When we talk about malnutrition, there are many aspects of malnutrition. So we look at now being more specific and focusing on underweight, stunting, being wasted, micronutrient deficiency, So, in these specific objectives, we are trying to narrow it down to see how we can achieve these things, okay? Because when you are going to tackle malnutrition as the whole, it might be very difficult, but you now need to zero it down so that you can see how to achieve these things easily. So when we talk about some things like stunting, we are looking at the comparison between height and then the age. Are you are you having the height that matches the standard age that you're having? So you do not expect someone to be 10 years when they are looking like a baby. That means that there is a problem, okay? Then underweight, of course, we are going to see all these scales that can always tell us whether someone is underweight or overweight or obese. So these scales are going to help us to know the parameters that we use. They are going to show us the numbers that we can always use to measure whether there is malnutrition, overnutrition in these people. So you shouldn't worry about how we are going to measure these things. Then another specific goal or another specific objective can be to improve the nutrition status of a specific demographic group. Like I was saying, malnutrition in the target population of say that southern part of South Sudan can be so broad. So now when you're zeroing it down into achievable objectives, then you look at things like the specific demographic groups like children under 5, pregnant women, the elderly, those people who are vulnerable to facing uh, these problems of malnutrition. Then another goal can focus on improving the dietary practices. And now to be more specific, you can look at increasing consumption of essential nutrients and protein-rich foods. You can look at reducing the intake of unhealthy foods like those which are high in sugars, fats, and salt, and also encouraging, of course, breastfeeding. And here, when we talk about breastfeeding in terms of nutrition, we are looking at that exclusive breastfeeding for the first 6 months, and then at least within a year, within 2 years. So you should be able to see that people are encouraged to breastfeed for the first 6 months exclusively, and then they can do in introducing some other solid food after that, but it should also be there for about 2 years, at least 2 years. So those can be specific objectives to achieve the other goal of promoting healthier eating habits and dietary diversity. So these make now achieving the goal, like I've been saying, easier. Okay, you can now think of achieving one thing at a time, or you can see a way you can divide your teams or put in place projects to 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 focus on each objective. So a project can focus on objective number one of increasing the consumption of essential nutrients in that population that was focused on by the goal. Then another project can, after that has is done with, you can have another one to focus on reducing the intake of unhealthy foods. Then another one can also encourage breastfeeding. You can also have these projects running concurrently if you have the necessary resources. Yeah, so how do we then design these programs that address nutrition issues? So you do not just come out of nowhere and say that I'm going to implement this program onto a population. You cannot just see maybe a few children on the street who are malnourished or who are having issues to do with nutrition, and then you say there is a need for a program to be implemented here. No, you have to do what we call a needs assessment, and this really helps you to unearth whether uh, what you think is needed is what the target population needs. Okay, because it is one thing to implement a project and another for that project to be successful, but for the success of any project or a program, you need to involve this population. They are the ones who know what they need. They're the ones who know what is affecting them. So you do not want to alienate them from your programs. So that is why you do this comprehensive assessment of nutritional needs. What does the population need really? And this is done through surveys, which can be of a short-term basis. You can analyze data that has been captured maybe at hospital settings where these people uh, go to receive care. Then you can also uh, do a needs assessment that involves community members, where you conduct community outreaches, where you conduct community meetings. You can also do stakeholder consultations. There are always these people who have influence and have opinions that matter in terms of nutrition. Okay, so when you consult these people that are always in touch with this target population, you are able to get that comprehensive assessment of the nutritional needs. They are the people who know and have this information that is very accurate. Then, after you've done that, you need to set clear objectives. What are you going to focus on as a project? And like we said at the beginning, those objectives or goals should be specific, measurable, they should be relevant or realistic in that context, and then they should be time bound. So we had already talked about those aspects of being specific, measurable, achievable, and time bound. And now, in terms of relevant, you need to bring something that is realistic and is going to be relevant in that target population. Okay, so you cannot go to a population of a Muslim population, and then now you start encouraging them to eat something that they do not like. Okay, so you need to make sure that as you set these objectives, you have that in mind. Then after that, you identify the target population. and here you want to define the specific demographic groups in that target population. How many constitute, for example, the under fives? How many constitute the adults, the young adults? How many constitute the elderly? How many pregnant women are we having here? How many people are employed? How many people are not employed? How many people are educated and which levels? So you need to know all these social demographic factors so that you can really uh, appreciate what your target population is composed of, because then you will be able to design very specific objectives that can really address the needs of each and everyone out there. Then after that, you develop the program strategies, and these are really what will help you to address the identified uh, nutritional needs. And this could include dietary education, whereby you sit these people down and then you tell them, yes, you've been eating this, but now we have to change. Okay, if you have been taking a lot of sugar, how about now you educate them the ills of taking a lot of sugar, and see them through that change process of taking enough or reduced sugar levels. Then food distribution, whenever you discover that malnutrition is being caused by lack of food or food insecurity, then you might have to engage in food distribution. As a project or a program, you might not be having this food to distribute, but with a lot of stakeholder involvement and engaging other people, other organizations, you can get this food and supply it. You might not be having it, but if you involve other people, you make contacts here and there, then you can get this food. Then sometimes you realize that they have the food, but it is lacking micronutrients. Micronutrients are really these nutrients that we require in our body, but in small quantities. Things like iron, things like iodine. So they are required, but they are required not in large quantities. You cannot compare them with things like proteins. Okay, so when you realize that these micronutrients are lacking, then you can do micronutrient supplementation. Uh, Sometimes people could be adamant to take on some nutrient foods, and then you now have to do what we call behavior change communication, where you focus now on changing the behavior of people into that will enable them to have better nutrition practices. So after you've developed those program strategies on how you're going to implement implement your program and address these identified needs, then now you establish the program components. What is going to be composed of this entire program? You're going to have things like dietary counseling and education, food provision, like we had said, healthcare services for those who are suffering from things which are severe, like severe acute malnutrition, which we are going to look at. Then monitoring and evaluation to track whether your program is working or not, whether it is achieving the objectives that were set or not, and what you can do to put it in the right direction. So monitoring and evaluation is something that will be very helpful in your program. It will help you to notice some inevitable changes that you have to put in place. So you can imagine if you're supplying food rations or some nutritious food for the under five children, but you have neglected the other people. So you supply this food to maybe a family X, but there are other people who are not having food. Okay, so you might, from of course this monitoring and evaluation, you're going to note that yes, you supplied this food, but these young children, all those people who are under 5 years, are not are not are not gaining anything from it. The malnutrition is still there. And why is that? It's because this food that you're supplying is being taken away by the older people, you get, who are also having their issues of food insecurity. They are not having enough food. So you need to know all this, and this can be possible through robust monitoring and evaluation in any program. There is that aspect in monitoring and evaluation which is called learning. You learn uh, from 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 what you are implementing, and when you learn, you make sure that you change before it is too late. Then after you've done that component of establishing program components, you now design the nutrition interventions, and basically these can include uh, now the detailed plans for each intervention. And after that, of course, there is no program that can exist without a budget, which will estimate the financial resources that are required to make this program move on. So you look at those personnel costs, people that you are going to hire, how much are you going to pay them, the material costs, the food rations that you want to supply, how much are they going to cost, okay? External funding sources. So you have to create a budget, and this budget will show how this money will be got, for example, from these external funding sources or like the donors, and how it is going to be spent. Okay. And as we continue in our monitoring and evaluation sessions, we are going to learn how to make a good budget, and you are going to see interesting things. Okay. Then you seek funding now after you've made a budget, because these funders cannot provide you with anything without seeing where the money is going. So they are only able to see that by you providing the budget. So when you're done with the budget, now you can call on to either government to help you fund your project, international donors, foundations, and partnerships with NGOs and other private organizations. Sometimes business owners can be willing to fund this project as part of what they call corporate social responsibility. So you do not run away from those people. If you are not able to get funding from the government or international donors, you can always go to these business people also. Then after you've sought that funding, then now you can do or develop a monitoring and evaluation framework. Yeah, so this will show you, you will be able to define those key indicators. You will be able to define the data collection methods. Yeah, you want to know what will show that there is progress in this program. Okay, if we are focusing on reducing stunting, so the indicator now will be that 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 aspect that will enable us to know that there is either progress or not. That measurable aspect that can be put out there, and we say the stunting has reduced or not. So we can look at things like the number of children who who are not or who are above the level of stunting, and we are going to see that measure that is considered to be the normal measure for those children to not be considered as stunted. So those key indicators should be defined in trying to develop this monitoring and evaluation framework. And then what are you going to use to collect this data? Okay, so you're saying that you want to know the number of children that are not stunting after you put on your program. But how are you going to collect that data? Are you going to put on a survey? Are you going to collect the data from the hospitals? Are you going to go to the community and do that okay, and do that cross-sectional study? So you should define this as you develop your monitoring and evaluation framework. Then after that, you need to establish partnerships, collaborate with the relevant stakeholders. You cannot do anything in any country without collaborating with the government agencies. You have to also involve in the NGOs. These NGOs, sometimes you might want to design a nutrition program, and you lack data and you do not have time to maybe go and collect it in the community, but there is an NGO which had already designed a program that is close to what you want to design. So this NGO, there could be there could be a possibility that this NGO already has some data. So if you collaborate, if you establish this partnership, then you can always get some knowledge from them. Then the community members, the healthcare providers are very essential in terms of these nutrition programs or any program per se. So after you've done that, now you implement, you put on an implementation plan, and here you want to really detail how the timelines. You need to detail the responsibilities of each one on board, all those stakeholders. You need to define their responsibilities, and this will ensure that all the program components are well coordinated. Then you also need to train your staff, both those who have been recruited and those who are volunteering and need to be trained, and what they are going to do needs to be aligned with the program objectives and goal. Then you cannot also put that program out there without testing it. So you can do what we call a pilot test. You do this pilot test in a population that is having similar characteristics with what with your target population. You do not want to pilot test your program in an urban setting when you are going to implement your real program in the rural setting. So that's why pilot testing is also very essential and should be given a lot of keen interest. So after you've done the pilot test and it is successful and you've seen things are going well, now you do launch the program. Okay, so when you launch the program, of course, there will be government officials, there will be partner NGOs, so they come together and it is now officially kickstarted. Then from that word go, you start monitoring, you start evaluating, you start seeing whether it is going as planned. Okay, assess the program progress, you make data driven decisions. Anything that you do in this program should be informed by the data that you're collecting through this robust monitoring and evaluation. Then adjust and expand, like we said, based on that ongoing monitoring and evaluation, you're able to adjust the strategies so that they can be what you really need to achieve your set objectives. Okay, and this is always done with involvement of all the stakeholders, especially the target population. So you might not have all the target population altogether, but you can always use the leaders or those volunteers from the target population who are able to give you information. Yes, they can be telling you, yes, you gave us these food rations, but people are not, they do not like them, you know. Maybe they produce some scent which is not what they expected, you know, so they are not taking them. So you're able to learn and adjust, you know. So if you have another option, now you bring it in, or you engage them and you tell them, yes, there could be an undesirable scent in these food rations, but they are good and they are not going to affect your health. So all this is done uh, and is informed by a very good monitoring and evaluation process. Then the last bit is more of advocacy and sustainability. You want your project to be to last the or the program to last the test of time. You shouldn't implement a program which is going to die off after a year. You know, communication and reporting. You need to always communicate with the stakeholders, the donors on a regular basis on how your program is progressing, the results, the challenges here and there, so that they can also help you in adjusting and making your program in a way that helps you to achieve the set objectives. Then again, we learn and adapt, be open to learning from the successes and failures. So we had tackled the bit of failures whereby we saw that if there are failures, you adjust and now make them make it a better program or make a better strategy. But if there is a success now, you want to reinforce it. You know, if there is a success, for example, from health education of these members, if you note that they are changing behavior due to the health education talks that you're giving them about nutrition. So if they have now been two education that you give, then you now can increase to 4 in a week. Okay, so that is learning and adapting. Are we still together? Yes, I wanted to
Yes,
check if
sir,
we are
we
still
are.
together. Are we still? Yeah, I know the speed could be a bit high, but I also wanted us not to be uh, taken away. But I'm trying my level best to make sure that we bring it out very clearly. But so there are many steps that are involved here in designing nutritional programs, and that could even exceed this according to other scholars. But basically, you have to know that most important, the most important things are to ensure that you get a comprehensive assessment, or you understand what these people need, where you want to put your project. You establish very smart strategies, very smart objectives, those which are specific, which are measurable, which are uh, attainable, which are realistic or relevant and time bound. Then now you need to make sure that you design those interventions that you are going to put in place. After that, you create a budget and seek funding. Then you have to make sure that monitoring is always there from the word go. What you're doing, is it really going to lead you to the goal that you want? Is it going to lead you to the outcome that you want? And if not, how do we change? Okay, involve people that have interest in that project. Okay, NGOs, uh, donors, and also especially the target community. Then you train staff, you pilot your program, implement it now, monitor and evaluate it again, go on monitoring and evaluating it, communicate with the relevant authority, the relevant stakeholders, then again do monitoring and evaluation so that make it make it a program that you really want to achieve the set objectives. Yeah, so that is really what I wanted us to learn. And the remaining slides are just really making us get acquainted with the gist of monitoring and evaluation. And like I said earlier, understand what effectiveness and efficiency really means. So when you're implementing a program or a project, there are those two words, efficiency and effectiveness. So when we talk about effectiveness, we are looking at doing that right thing, doing what you wanted. So you wanted to reduce malnutrition in this among the people in living in the south part of South Sudan. So for your program to be considered effective is when you reduce that malnutrition, either by 2%, either by 5%, according to what you set in your objectives. But now, when you talk about efficiency, we are looking at more of doing it right. You know, so we are looking at reducing the cost in whatever you're doing. So you reduce this malnutrition, and you are considered effective, but at what cost? Okay, so if you are using $50 billion to reduce malnutrition, really that would not be efficiency. Okay, I always use an example of a road in a country that is in East Africa, where what it is, when you go there, it is a very good road that was very well constructed, but each kilometer cost, it cost the people of that country $1 million. So you look at such a project and you see, really, yes, they delivered the project and it was considered effective, but it wasn't efficient. There was a lot of the cost was too much to deliver that project. So that is what we call, that is how we can differentiate efficiency and effectiveness. And as M&E professionals, we need to learn those two words. We need to learn how we can always look at them, because it's what we stand for. So it is really, monitoring and evaluation looks at all that: the progress, the effectiveness, the efficiency, and impact. And it is always done to make sure that we adjust and adapt to the better strategies or approaches to make sure that our program succeeds or is sustainable. Then we also note that it involves, of course, collecting, analyzing, and interpreting data. And in nutritional programs, we usually collect a lot of data, like all the other programs. We, of course, you cannot just collect data and put it to rest. You need to analyze it so that it can make meaning to you and the people who are concerned with that program. Then you need to also give feedback, especially to the relevant stakeholders. Yeah, so that was monitoring. Then when we look at now evaluation, like I had said earlier, it is more of that comprehensive and periodic assessment of the overall performance. So monitoring is ongoing, and it starts at the word go of the project. But evaluation can be periodic or even take place at the end of this program or project. So it involves examining the program's effectiveness, efficiency, relevance, and sustainability. And this is what we had looked at earlier. I've been talking about these words in one way or the other. So the key aspects in evaluation of, especially in nutrition programs, is you assess the outcomes and impact. Like I was saying, evaluation can take place periodically, maybe after a year of a program, which is supposed to take 10 years or more. We can look at now, after a year, what has happened. After 2 years, what has happened, you know. So that would be evaluation. So we are assessing the outcomes, the impact. So impact is more of a longer term than the outcome. Okay. Then we compare results, we identify the lessons learned, and of course, we use these lessons to improve future programs or even that actual program. So the benefits of all these M&E in nutritional programs is that you're able to determine the effectiveness and impact of nutrition interventions. And like I said, the effectiveness is really looking at whether what you set out as a program is what you achieved. Then the efficiency bit is now looking at what cost. Did you do it right? Yes, you achieved it, but at what cost? Okay. Then through M&E, we are also able to track progress toward achieving nutrition-related goals and objectives. We hold the implementers, the donors, and stakeholders accountable using M&E, because remember, we collect data here and there, we analyze it. Yes, you said you want to reduce stunting among under fives, and you wanted maybe to reduce it from the 20% that it is at to 10% in just in 2 years or five. But after 10 years, you are still at 20. So we are able to use this data that we have collected through M&E to create this accountability. Okay. Then it provides data-driven insights to inform program adjustments. As M&E people, we need to always inform these people using this data that has been collected and analyzed. Communicate program achievements and outcomes to stakeholders. So when you do evaluation, when you do monitoring, you're able to get all these achievements uh, through that data that has been analyzed, and you can always communicate to the stakeholders and the beneficiaries. Then it facilitates the culture of learning and continuous improvement, and this is what I've been talking about. You do not have to first wait for the program to end to rectify the mistakes. Anyway, you wouldn't even have the time. The opportunity will have passed. But through M&E or use of M&E, you're able to notice even uh, way before it is too late that there could be a problem, and now I could improve in this area. Then it ensures resources. Uh, it ensures that resources are allocated efficiently and effectively, promotes transparency and openness, because when you know that there is monitoring and evaluation, then the implementers will always be transparent. And even when beneficiaries are receiving information about this, it really promotes that spirit of openness and transparency in all this, the operations, the data collection and reporting, because there are always, of course, ethics, rules, and protocols that are involved in M&E uh, in M&E operations, as we are going to see in time. Then it contributes to nutritional interventions, long-term sustainability. Yeah, the program is able to last the test of time, like I said, because if you're learning and adapting, that means that the chance of your program failing is really limited. So if it doesn't fail, then it will be sustainable. Then it also encourages using evidence and data, because you're collecting data and using this data to inform the decisions. So it encourages that evidence-based decision making, and also makes it known that you should engage and empower beneficiaries by involving them in all these M&E processes, whether it is data collection, whether it is analysis, whether it is giving them feedback. When you involve these beneficiaries, when you involve your target population, either through their leaders, either through their representatives, they are able to own this program. And when it is owned, when they take responsibility of this program, then it is able to be sustainable. And they are empowered. They feel that they can do some things. Okay. So this is very possible when you do M&E under nutritional programs. So a few things, and we call it a night. We look at things like indicator, which I had talked about earlier on, and these are just measurable, quantifiable, specific variables that are used to assess progress, performance, or outcomes in nutritional programs. So if you're having a program of reducing stunting in the under fives, so now you can use an indicator of, for example, number of under five children who are facing stunting, or who are having this height for example, the height of 30 centimeters and below. So if you say the number of under five children having the height of 30 centimeters and below, that will be an indicator. Someone can really use that to measure whether there is progress or not. So this is what uh, will enable this M&E work to be smooth. Then the other thing is data sources. Program does not leave anyone behind, or you also want to leverage on the influence of some people. So sometimes there are politicians who have a lot of influence in a particular area. So if you note that, now you make sure that you involve those people. You use their voice to create a lot of behavior change communication amongst that target population. You make sure that you involve them. They also feel that they are part of this program, and then they can preach your message to people who believe in them more than they believe in you. So that is all about stakeholders and M&E in nutrition. And this is basically the introduction. We shall be now going on to look at the gist of how to do particular things here and there, the challenges that can be faced, and appreciate how M&E is really important in nutrition programs and projects. So thank you so much, and I will request to take on a few questions, clarifications, and we can call it a night for this session. Do we have any questions? Two or three? Yes, Clara Poe, I can see your hand. Please unmute
Yeah,
and ask your question.
yeah, my question is about piloting. You talk about piloting the program, but I don't know how to pilot it. Can you explain more, explore more? That is number one. Number two is about data analysis. You talk about data analysis. How can we analyze the data? Thank you.
Yeah, so thank you so much, Clara Poe. So you asked about piloting, uh, and the pilot test of a program or a project is basically to really kind of implement this project, but of course in a very short time, in another target population or within another setting that is not that which you are targeting. Okay, so if I'm going to the south of South Sudan, now I can pilot my program in the east of South Sudan. Okay, target some few people here and there, and then see how it will work for a short time, and then if it works, then I can go on and implement it the other side. If there are also some challenges, I can use those challenges to inform me on how to improve and make the program better, so that when I take it to now the south of South Sudan, I'll not face the same challenges. Then the other thing of data analysis, of course, we shall look at it in more detail, but just like I had explained, is more of making meaning of the data that you have collected. So the data that you get from the field is basically figures, and is a lot. It's a lot of things, but now you need to bring it together and make something that is meaningful. So if you collect data from like 300 respondents of children under 5, there is a lot of data you have collected, maybe on whether the mother is employed, whether they are educated, whether they are not, whether they sleep in a single room. So all that is a lot of data. But now in analysis, now you want to know how many of the mothers are educated, how many of the mothers are employed. Then you can also go on in analysis and say and try to also unearth and say and look at, of the unemployed, how many of their kids are having stunting, and maybe that can show you that perhaps it is because of the unemployment that is now leading them to having stunted children. Then you go on and show the relationship, and maybe as we shall see through qualitative analysis, through qualitative data collection and analysis, shall discover that you can even get stories of these people where they tell you, because I'm unemployed, I cannot get money to afford the food to provide for my kid, and that's why they are stunted. So this data analysis really makes sense of the other raw data. Okay, you want to get you want to make meaning of all that, all those figures, all that uh, all that work that you have collected from the field. Now you want to make meaning of it. I don't know if you are understanding what I'm saying, Clara.
Yes, it's well
Okay.
explained now. Yeah, thank you.
Sorry.
I'm saying it's well explained.
All right. Thank you.